Welcome to the Big Guy Podcast here on ACAST. We invite you to become members of ACAST Plus. Thank you.
Hello, thank you for joining us today. We are really glad you are here. Please sit back and open your hearts. Here's Jim, your host of Time Out with Jim. So, let's get started.
Today we're going to be talking about diabetes. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, which is also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells that stop responding to insulin, too much sugar stays in your bloodstream. Over time, that can cause serious health such as heart disease, vision loss, and kidney disease. There isn't a cure for diabetes, but losing weight, eating healthy food, and being active can really help. Taking medicine as needed, getting diabetes self-management, education, and support, and keeping healthcare appointments can also reduce the impact of diabetes on your life. 34.2 million U.S. adults have diabetes. One in 5 of them don't know they have it. Diabetes is the 7th leading cause of death in the United States. Diabetes is the number 1 cause of kidney failure, lower limb amputation, and adult blindness. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled. There are 3 main types of diabetes: type 1, type 2, and gestational diabetes, which is diabetes while pregnant. Diabetes is thought to be caused by an autoimmune reaction that stops your body from making insulin. Approximately 5 to 10% of the people who have diabetes have type 1 symptoms. Of other people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes. People with type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at a normal level. About 90 to 95% of the people with diabetes have type 2. It develops over many years and is usually diagnosed in adults, but more and more in children, teens, and young adults. You may not notice any symptoms, so it's important to get your blood sugar tested if you're at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes, such as losing weight, eating healthy food, and being active. Gestational diabetes. Gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk For health problems. Gestational diabetes usually goes away after your baby is born, but increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity or as a child or teen, and more likely to develop type 2 diabetes later in life too. Pre-diabetes. In the United States, 88 million adults, more than 1 in 3, have pre-diabetes. What's more than 84% of them don't know they have it. With pre-diabetes, blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2. Pre-diabetes raises your risks for type 2 diabetes, heart disease, and stroke. The good news is if you have pre-diabetes, lifestyle change can help you and take steps to reverse it. Type 1 diabetes is thought to be caused by an immune reaction. The body attacks itself by mistake. Risk factors for type 1 diabetes are not as clear as for pre-diabetes. In type 2 diabetes, known risk factors include family history, having a parent, brother, or sister with type 1 diabetes, and age. You can get type 1 diabetes at any age, but it's more likely to develop when you're a child, a teen, or young adult. Type 2 diabetes, you're at risk if you have pre-diabetes, are overweight, 4 to 5 years or older, have a parent, brother, or sister with type 2, physically less active than 3 times a week, have ever had gestational diabetes, are African American, Hispanic, Latino American, American Indian, or Alaska Native. Some Pacific Islanders and Asian Americans are also at higher risk. If you have non-alcoholic fatty liver disease, you may also be at risk for type 2 diabetes. You can prevent or delay type 2 with simple, proven lifestyle changes, such as losing weight if you're overweight, eating healthier, getting regular physical activity, exercise, walking, stuff like that. Pre-diabetes, you're at risk for developing pre-diabetes if you are overweight, 4 to 5 years older, have a parent, brother, or sister with type 2, physically active less than 3 times a week, have ever had gestational diabetes. You can prevent or reverse pre-diabetes with simple, proven lifestyle changes such as losing weight. If you're overweight, eating healthier and getting regular physical activity can help you make healthy changes that have lasting results. Gestational diabetes while pregnant. The risks had gestational diabetes during a previous pregnancy, have given birth to a baby who weighed more than 9 pounds, overweight, more than 25 years old, have a family history of type 2, have a hormone disorder called polycystic ovary syndrome, or African American, Hispanic, Latino American, American Indian, Alaska Native, Native Hawaiian, or Pacific Islander. Gestational diabetes usually go away after your baby is born, but increases your risk of type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen, and is more likely to develop type 2 diabetes later in life. Before you get pregnant, you may be able to prevent gestational diabetes by losing weight if you're overweight, eating healthier, and getting regular exercise. Diabetes symptoms. Get your blood sugar tested if you have any symptoms of diabetes. If you have any of the following diabetes symptoms, see your doctor about getting your blood sugar tested. If you urinate a lot, often at night, are thirsty, lose weight without trying, you're very hungry, have blurry vision, have numb or tingling hands or feet, feel very tired, have dry skin, have sores that heal slowly, have more infections than usual. Symptoms of type 1 diabetes. People who have type 1 may also have nausea, vomiting, or stomach pains. Type 1 symptoms can develop in just a few weeks or months and can be severe. Type 1 usually starts when you're a child, teen, or young adult, but can happen at any age. Type 2 diabetes symptoms often develop over years and can go on for a long time without being noticed. Sometimes there aren't any noticeable symptoms at all. Type 2 diabetes usually starts when you're an adult, though more and more children and teens and young adults are developing it. Because symptoms are hard to spot, it's important to know the risk factors for type 2 diabetes and visit your doctor if you have any of them. Gestational diabetes usually shows up in the middle of the pregnancy. It typically doesn't have any symptoms. If you're pregnant, you should be tested for gestational diabetes between 24 or 28 weeks of pregnancy, so you can make changes if needed to protect your health and your baby's health. What is prediabetes? Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2. Approximately 88 million American adults, more than 1 in 3, have prediabetes. Of those with prediabetes, more than 84% don't know they have it. Prediabetes puts you at an increased risk of developing type 2 diabetes, heart disease, and stroke. The good news is, if you have prediabetes, you can make lifestyle changes to prevent or delay type 2 diabetes and other serious problems. What causes prediabetes? Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. If you have prediabetes, the cells in your body don't respond normally to insulin. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes down the road. Signs and symptoms. You can have prediabetes for years but have no clear symptoms, so it often goes undetected until serious health problems such as type 2 diabetes show up. It's important to talk to your doctor about getting your blood sugar tested if you have any of the risk factors for prediabetes, which include being overweight, 4 to 5 years or older, having a parent, brother, or sister with type 2, being physically active less than 3 times a week, having gestational diabetes, and having polycystic ovary syndrome. The good news is prediabetes can be reversed. Race and ethnicity are also a factor. African Americans, Hispanic Latino Americans, American Indians, Pacific Islanders, and some Asian Americans are at higher risk. You can get a simple blood sugar test to find out if you have prediabetes. Ask your doctor if you should be tested. Preventing type 2 diabetes. If you have prediabetes, losing a small amount of weight if you're overweight and get regular physical activity can lower your risk for developing type 2 diabetes. A small amount of weight loss means around 5% to 7% of your body weight, just 10 to 14 pounds for a 200-pound person. Regular physical activity means getting at least 150 minutes a week of brisk walking or similar activity. That's just 30 minutes a day, 5 days a week. Working with a trained coach to make realistic, lasting lifestyle changes, discovering how to eat healthy and add more physical activity into your day, finding out how to manage stress, stay motivated, and solve problems that can slow your progress, and getting support from people with similar goals and challenges. For parents, if your child has type 1 diabetes, you'll be involved in diabetes care on a day-to-day basis, of serving healthy foods, to giving insulin injections, to watching for and treating hypoglycemia, low blood sugar. You also need to stay in close contact with the child's health care team. They will help you understand the treatment plan and how to help your child stay healthy. I would also include the teacher, the child's teachers. Tell them what they need to know, like if the child's blood sugar is spiking or getting low, what they need to do. And that is going to be it for part 1 of diabetes. And always remember, materials contained on here are for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you have a medical emergency, call your doctor or 911 immediately. It could take many months or years for enough beta cells to be destroyed before symptoms of type 1 diabetes are noticed. Type 1 symptoms can develop in just a few weeks or months. Once symptoms appear, they can be severe. Some type 1 symptoms are similar to symptoms of other health conditions. Don't guess. If you think you could have type 1, see your doctor right away to get your blood sugar tested. Untreated diabetes can lead to very serious, even fatal health problems. Risk factors for type 1 diabetes are not as clear as pre-diabetes and type 2 diabetes, though family history is known to play a part. Testing for type 1 diabetes. A simple blood test will let you know if you have diabetes. If you've gotten your blood sugar tested at a health fair or pharmacy, follow up at a clinic or doctor's office to make sure the results are accurate. If your doctor thinks you have type 1 diabetes, your blood may also be tested for autoantibodies that are often present with type 1 diabetes, but not with type 2. You may have your urine tested for ketones produced when your body burns fat for energy, which also indicate type 1 diabetes instead of type 2. Managing diabetes. Unlike many health conditions, diabetes is managed mostly by you, with support from a healthcare team, including your primary doctor, foot doctor, dentist, eye doctor, a dietitian, diabetes educator, and pharmacist, family, teachers, and other important people in your life. Managing diabetes can be challenging, but everything you do to improve your health is worth it. If you have type 1 diabetes, you'll need to take insulin shots or wear an insulin pump every day to manage your blood sugar levels and get the energy your body needs. Insulin can't be taken as a pill because the acid in your stomach will destroy it before it could get into your bloodstream. Your doctor will work with you to figure out the most effective type and dosage of insulin for you. You will also need to check your blood sugar regularly. Ask your doctors how often you should check it and what your target blood sugar level should be. Keeping your blood sugar levels as close target as possible will help you prevent or delay diabetes-related complications. Stress is a part of life, but it can make managing diabetes harder, including managing your blood sugar levels and dealing with daily diabetes care. Regular physical activity, getting enough sleep and relaxation, and exercises can help. Talk to your doctor and diabetes educator about these and other ways you can manage stress. Healthy lifestyle habits are really important too. Making healthy food choices, being physically active, controlling your blood pressure, controlling your cholesterol. Make regular appointments with the healthcare team to be sure you're on the right track with your treatment plan and to get help with new ideas and strategies if needed. Whether you just got diagnosed with type 1 or you had it for some time, meeting with a diabetes educator is a great way to get support and guidance, including how to develop and stick to a healthy eating and activity plan. Test your blood sugar and keep a record of the results. Recognize the signs of high or low blood sugar and what to do about it. Give yourself insulin by syringe, pen, or pump. Monitor your feet, skin, and eyes to catch problems early. Buy diabetes supplies and store them properly. Manage stress and deal with daily diabetes care. Ask your doctor about diabetes self-management, education, and support services, and to recommend a diabetes educator. You can also search the Association of Diabetes Care and Education Specialists online for a list of programs in your community. Hypoglycemia, low blood sugar, can happen quickly and needs to be treated immediately. It's most often caused by too much insulin, waiting too long for a meal or snack, not eating enough or getting extra physical activity. Hypoglycemia symptoms are different from person to person. Make sure you know your specific symptoms, which could include shakiness, nervousness or anxiety, sweating, chills, or clamminess, irritability and impatience, dizziness and difficulty concentrating, hunger or nausea, blurred vision, weakness or fatigue, anger, stubbornness, or sadness. Now, when my blood sugar gets low, I get the shakes, the nervousness, anxiety, sweating, chills, and I get a little dizzy. If you have got hypoglycemia several times a week, talk to your doctors to see if your treatment needs to be changed. Type 2 diabetes. What causes it? Insulin is a hormone made by your pancreas and acts like a key to let your blood sugar into the cells in your body for use as energy. If you have type 2 diabetes, cells don't respond normally to insulin. This is called insulin resistance. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes. High blood sugar is damaging to the body and can cause other serious health problems, such as heart disease, vision loss, kidney disease. Symptoms and risk factors. Type 2 symptoms often develop over several years and can go on for a long time without being noticed. Sometimes Sometimes there are not any noticeable symptoms at all because symptoms can be hard to spot. It's important to know the risk factors and to see your doctor to get your blood sugar tested if you have any of them. Testing for type 2. It's a blood test which will let you know if you have diabetes. If you've gotten your blood sugar tested at a health fair pharmacy, follow up with the doctor. Managing diabetes. Unlike many health conditions, diabetes is managed mostly by you. But you can get support from your healthcare team, a nutritionist, educator, a pharmacist, family, or other important people in your life. Type 2 diabetes in children and teens. Children obesity rates are rising, and so are the rates of type 2 diabetes in youth. More than 75% of children with type 2 diabetes have a close relative who has it too. But it's not always because family members are related. It can also be because they share certain habits that can increase their risk. Parents can help prevent or delay type 2 by developing a plan for the whole family. Drinking more water, eating more fruits and vegetables, making favorite foods healthier, making physical activity more fun. Insulin resistance and diabetes. Insulin acts like a key to let blood sugar into your cells to use as energy. Invisible changes in the body begin long before a person is diagnosed with type 2 diabetes. That's both bad news. No symptoms mean you won't know you have it. And good news, you can prevent or delay it if you're at risk. One of the most important unseen changes, insulin resistance. Insulin is a key player in developing type 2 diabetes. This vital hormone, you can't survive without it. Regulates blood sugar in the body, a very complicated process. Here are the high points. The food you eat is broken down into blood sugar. Blood sugar enters your bloodstream, which signals the pancreas to release insulin. Insulin helps blood sugar into the body cells so it can be used for energy. Insulin also signals the liver to store blood sugar for later use. Blood sugar enters cells and levels in the bloodstream decrease, signaling insulin to decrease too. Lower insulin levels alert the liver to release stored blood sugar, so energy is always available, even if you haven't eaten for a while. That's when everything works smoothly. But this finely tuned system could quickly get out of whack as follows. A lot of blood sugar enters the bloodstream. The pancreas pumps out more insulin to get blood sugar into cells. Over time, cells stop responding to all that insulin. They become insulin resistant. The pancreas keeps making more insulin to try to make cells respond. Eventually, the pancreas can't keep up, and blood sugar keeps rising. Lots of blood sugar in the bloodstream is very damaging to the body and needs to be moved into cells as soon as possible. There's lots of insulin too, telling the liver and muscles to store blood sugar. When they're full, the liver sends the excess blood sugar to fat cells to be stored as body fat. Yep, weight gain. And what's more serious, The stage is set for prediabetes and type 2 diabetes. Do you have insulin resistance? How do you find out? Not one test will tell you, but if you have high blood sugar levels, high triglycerides, high LDL cholesterol, and low HDL cholesterol, your healthcare provider may determine you have insulin resistance. What causes it? It isn't clear exactly what causes insulin resistance, but a family history of type 2 diabetes, being overweight, especially around the waist, and being inactive, all can raise the risk. I'm a little overweight, but my belly, hey, I just call it a beer belly. Anyways, you do not have to be overweight to have insulin resistance. You can't tell if someone has insulin resistance by looking at them. How to reverse insulin resistance. If you have it, you want to become the opposite. More insulin sensitive cells are more effective at absorbing blood sugar, so less insulin is needed. Physical activity makes you more sensitive to insulin. Weight loss is important too. Avoiding high blood sugar reduces stress. Test for type 1, type 2, and prediabetes. Your doctor will have to take one or more of the following blood tests to confirm the diagnosis. An A1C test. The A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7 is normal. Between 5.7 and 6.4 indicates you have prediabetes, and 6.5 or higher indicate you have diabetes. Fasting blood sugar test. Fasting like that. But when you go to bed, then you wake up, go to the doctor, have the test. They usually want you to wait 12 to 24 hours. This measures your blood sugar after an overnight fast, no eating. A fasting blood sugar level of 99 or normal, 99 or lower is normal. 100 to 125 indicates you have prediabetes, and 126 or higher indicates you have diabetes. Glucose tolerance test. This measures your blood sugar before and after you drink a liquid that contains glucose. You'll fast, no eating, overnight before the test, and have your blood drawn to determine your fasting blood sugar level. Then you drink the liquid and have your blood sugar checked 1 hour, 2 hours, and possibly 3 hours afterward. At 2 hours, a blood sugar level of 140 or lower is considered normal. 140 to 199 indicates you have prediabetes, and 200 or higher indicates you have diabetes. Diabetes fast facts. The big picture. More than 34 million people in the United States have diabetes. 1 in 5 of them don't know they have it. More than 88 million U.S. adults, over a third, have prediabetes, and more than 84% of them don't know they have it. Diabetes is the 7th leading cause of death in the United States and may be underreported. Type 2 accounts for approximately 90% to 95% of the diagnosed cases. Type 1 accounts for approximately 5 to 10%. In the last 20 years, the number of adults diagnosed with diabetes are more than doubled as the American population has aged and become more overweight or obese. So that's end of the last and part two and the last of diabetes. And always remember, materials contained on here are for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because it's something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately.
We truly hope that you enjoyed this podcast today. And if it touched your heart in any way, please share it with your family and friends. And please consider donating whatever your heart tells you. If you wish to do so, please go to the following link: anchor.fm/timeoutwithjim. And again, it's ANCHOR.fm/TIMEOUTWITHJIM. This will help us keep this podcast going. Thank you for listening, and until next time, keep your heart flowing, and God bless to all.
Thank you for taking your time out to give us a listen. And remember, become a member of ACAST Plus. God bless.